Hi, my name is Jackson Fyfe. I'm a Senior Lecturer in Exercise Science at Deakin University, and I'm also on the EMCR Committee of the ANZ SSFR. So today I wanted to highlight the role exercise can play in both preventing and managing sarcopenia in older adults. So although exercise of various forms has benefits, we know that resistance exercise has the greatest positive effects on components of sarcopenia, including muscle mass, strength, and also physical function. So really the main recommendation when it comes to exercise for preventing and managing sarcopenia is to incorporate some form of resistance exercise at least twice per week. So this could be performed in a gym environment, such as lifting weights or using machines, or it could even be performed in the comfort of your own home, by doing exercises that involve your body weight or basic equipment such as resistance bands or household items. So when doing resistance training, it's best to choose exercises that use a number of large major muscle groups at once. This really just helps ensure that your training is efficient and also uses movements that are more likely to improve your ability to perform daily tasks such as rising from a chair, walking upstairs, or simply walking around. So just following a simple resistance training program twice per week will have considerable benefits. There are also some other factors that may improve the benefits even further. So we know that not only with aging do we lose muscle and strength, we also lose bone mass. And this increases the risk of other adverse outcomes such as fractures. So resistance training with moderate to high loads, we know that that is more effective than other forms of exercise such as walking for improving bone mass. But we also know that doing more dynamic exercises, particularly where forces are applied quite rapidly in multiple directions, we know those types of exercise are most effective for improving bone health. So examples of these types of exercise are things like hopping or jumping or doing push-ups in an explosive way. So to maximize bone health, we should try to incorporate, if we can, these types of exercise into our program. But importantly, they should be guided by an appropriate exercise professional, such as an accredited exercise physiologist, who can help to adjust these exercises based on your individual circumstances and in particular your individual risk of experiencing a fracture. Some other things we should try and incorporate into our exercise program, if we can, are to incorporate exercises that challenge our balance. We know that loss of balance with aging increases the risk of falls and associated injuries. And just doing traditional resistance type exercises like squats or push-ups, we know those sort of things don't really have a great impact on our balance. So we need to be incorporating exercises that specifically challenge our balance. So things like doing single leg exercises, rapid stepping exercises, navigating obstacles, these kinds of exercises are what really helps improve our balance. Other recommendations are to try and train what we call our stabilizing muscles. So we know that with aging, we lose strength, but this doesn't affect all of our muscle groups equally. And in particular, muscles that play more of a stabilizing role and help to keep our joints nice and stable during movement, particularly in the lower body. We know that those muscles tend to lose more strength than muscles that are primarily responsible for generating movement. So because these stabilizing muscles really help us maintain our stability and balance during movement, inclusion of these exercises is important to help with balance and also mobility. So these types of exercises could be single leg exercises like lunges or step ups. These kinds of things train the stabilizing muscles a little bit more. So incorporating them in your program can possibly have a greater impact on your ability to move around and be mobile and maintain your balance. So we know that unfortunately loss of muscle and bone with aging is inevitable, but really the magnitude of these losses and importantly how they impact on our independence and general health are not set in stone. And we know that through resistance training, we can help to offset some of the negative effects of aging on muscle and bone health in particular. So if you're not currently doing any resistance training, the best time to start is now. It's never too late. So if you do need support or advice on exercise more generally, it's best to book a consultation with an accredited exercise physiologist or an AEP, who are really best placed to help design an exercise program that's tailored to both your individual goals and also your needs.